sort of spoken about Python. It's now time for something completely different. I'm probably one of the lone people in the conference who is actually an animal-based researcher, and I'm going to try and show you, hopefully convince you, that there's a viable path forward for a new way of looking at animal models of progressive neurological dysfunction. So, just very briefly, you're probably first of all wondering where Prince Edward Island is. So if you know where Boston is or New York down here, you can fairly easily see that we're up here on the east coast of Canada. Montreal is way over here. It's our closest large neighbor, approximately 1,200 kilometers to the left. Yes, it's a very big country. And if you come here to visit us, you can spend lots of relaxing time out in the countryside. You can see all sorts of beautiful scenery.
What we close with animals.
You know, go out on a fishing boat and catch yourself a lobster. And you can also come visit us at the university. And what you'll find is that we have some remarkably modern facilities. This particular structure is our new Center for Comparative Biomedical Research, which I have the privilege of being the director. It's actually associated with the Veterinary College, but it's a new construction. It only opened in 2008. And just as a shameless plug, it has a whole variety of specialized laboratory facilities as well as generalized facilities. But what I want to draw your attention to is that we have lots of office and carrel space as well as lab space for visiting scientists and students. And so if people would like to come, I'm very happy to help facilitate that. And there's the website on the top, and it's on my card if you want to see the app. Okay, so I think everybody's seen slides something like this. This is a basic cartoon to just illustrate what I think we all now accept, and that is that neurological diseases are progressive in many cases. And so this is just a general, non-specific indicator of central nervous system health. And so at some point in our life, probably very early in our life, we have a healthy brain, right? And then something happens, something that we may be able to identify, something we may not be able to identify, which then causes the beginning of a neurodegenerative cascade. This is similar to what Sylvia showed you a few moments ago. And it's only down here, so this is happening with no clinical signs. It's only down here when we start to see clinical signs that we can have a definitive diagnosis. And at this point in the process, we're pretty well restricted to palliative therapies. And that, of course, is extremely frustrating for all of us and frustrating for those people who either have the disorders or even more perhaps for the caregivers. So what we need to do, obviously, is we need to find ways to intervene in the process early to either slow the process so that you die of some natural cause before you actually develop the symptoms, or we stop it entirely. But the bottom line is that this is the area that we need to be targeting. The problem is that we don't know the targets that are happening here in most neurological diseases. And one of the big problems, I think, with traditional animal models, and I'll be honest with you, I mean, animal models for the most part have a pretty lousy predictive record in terms of developing new therapeutics, right? And part of the reason is because they're all targeted at the symptoms, so the late stage disease symptoms, right? And usually even those symptoms that are primarily associated with a disease label, right? Like your Parkinson's patient, you have tremors, and we're going to try and get rid of the tremors, those kinds of things, right? If you're an epileptic patient, you have seizures, so we're going to use an animal model that produces seizures, and we're going to develop anticonvulsants, right? That's not treating the disease, that's treating the symptoms. And it's primarily the symptoms that are the most debilitating and which cause the greatest concern. Okay, so what we need to do then is we need to find models which, if we're going to identify targets, we need to find models which mimic this process and which we can follow in a reliable sequence and then tease out the actual molecular mechanisms that are involved. Okay, so what I want to do, hopefully briefly, is I want to give you just two examples. There's a couple more in the article, in the journal, but I want to just give you two examples. And the reason I like these two examples, to be honest, one of them is mine, but the reason I like both of them is because they're actually examples of what I call translational medicine reversed. In other words, in both cases, the patient profile happened first, right? And you're going to see where I'm coming from with this, right? So an unusual intoxication event produced a disease phenotype which was similar to a neurological disorder. We then took that and then utilized it to create an animal model that we know is showing the same signs as the patient showed, right? And then hopefully through the use of that model, we can identify targets which we can then intervene with so that we can develop new therapeutic strategies to actually translate back to the patients. Okay? All right. So the first example, and this is data that actually, these slides have come courtesy of a collaborator of mine, Chris Shaw from the University of British Columbia. And he's been studying for some time a very peculiar syndrome called ALS-PDC, or amyotrophic lateral sclerosis Parkinson's disease complex, that was identified in people from the island of Guam. And basically, this is the disease state in which there's an ALS phenotype. There's also a Parkinson's phenotype, and that Parkinson's phenotype, like in many cases, but not all cases, Parkinson's is also characterized by dementia. Okay? Now, there's a familial clustering to this, so that there are presumably genetic susceptibility factors, but they're not seen as being causally related. There's a differentiation between the incidence in males and females. It also shows some interesting features of early disturbance, which are similar to Parkinson's disease. But the interesting thing is that there's a strong dietary link to a neurotoxin, which is contained in the seeds of this cycad palm. Now, under normal circumstances, the people on Guam do not eat this, or at least historically did not. But during the Second World War, there was a distinct shortage of food. These people were starving. They started to grind up the seeds, use them as flour, and then shortly after that, we started to see the emergence of this disease phenotype. Okay. So that then suggests, and I'm just going through this very quickly, a relatively simple experiment. And that is, if you take the seeds from the cycad palm, right, and you make sure that they're not contaminated with any of the other known neurotoxic agents or agents that have been associated with this kind of thing, and feed it to mice over a very prolonged period of time, and then you take them at different stages and do behavioral monitoring and also immunohistology either at the end of a long period of feeding or after a delay period when they've been on regular feed. You know, what do you get? You get things which are consistent with ALS, with Parkinson's disease, with both, that sort of thing. And so again, Chris has published all of this data, and whether you look at MRI data, looking in the spinal cord, looking particularly at volumes in the ventral horn, you see a significant decrease in the animals that are fed the cycad flour. You can also do the same thing looking at the motor neuron counts. You can look for markers using immunohistochemistry of neurodegenerative or inflammatory processes, degenerative processes that are happening within the spinal cord. And you can also do behavioral tests, which would be consistent with the kinds of things that we do for symptoms of these disorders, so motor coordination, muscle strength, gait analysis, things like that. So to just briefly put that all together, what he has found, and other people have found as well, clearly, is that in these mice, right, that there are many, many areas, progressive motor weakness, speed impairment, cognitive deficits, olfactory dysfunction, motor neuron losses and changes in transmitters and transmitter-related systems, which are consistent between the model, the animal model, and the human disorder. Okay? So again, this is something which has developed over a very prolonged period of time. I don't have time to show you all of this, but you can trust me that they get progressively worse as things go along. Okay. And of course, we need to then go a little bit beyond that, and so he subsequently followed that up by identifying what he believes to be the ingredient which is primarily responsible